My name is Terry King. I'm the Chief of the Division of Breast Surgery at Dana-Farber Brigham and Women's Cancer Center and the Associate Chair for Multidisciplinary Oncology in the Department of Surgery at Brigham and Women's Hospital. Breast surgery is generally very safe surgery. Most of our procedures are performed either under monitored sedation with local anesthesia or relatively short periods of general anesthesia, if, for example, if mastectomy and reconstruction is performed. So the primary risks associated with breast surgery include the risk of allergic reaction to perhaps one of the dyes or tracers that we use to identify the sentinel lymph nodes. And although these reactions are rare, it is important that patients are aware that there is a small chance of an allergic reaction. The other primary risks associated with breast surgery include the risk of bleeding postoperatively, which may require return to the operating room. Again, this is quite rare, happening in about 1 in every 100 cases that we perform, but again, should still be discussed. There's also a risk of infection requiring antibiotics after surgery. Again, this is not common, happening in about 5 of every 100 patients that have breast surgery, but this again should be discussed, and patients should be instructed as to what to look for to represent signs of infection after surgery. After breast surgery, either on the breast or in the lymph node area, it's natural for the body to produce fluid, and so everybody gets a little fluid collection. We call this a seroma, and a seroma is not a it's not a complication per se, it's an expected outcome of breast surgery. But if a woman gets a large seroma, if she gets a large fluid collection, then this can be uncomfortable, requiring aspiration back in the clinic by the surgical team. The most significant complications, though, from breast surgery are not actually what we do to the breast, but are actually associated with the lymph node surgery. So the most feared complication among our patients is the risk of lymphedema. And lymphedema results from a disruption of the lymphatics under the arm during the sentinel lymph node procedure or during a complete lymph node dissection. So we really have paid a lot of attention over the last several decades to reduce the amount of lymph node surgery that needs to be performed in order to reduce the risk of lymphedema. So after lymph node surgery, it's very common for women to have numbness or tingling under the arm or on the back of the arm. And this usually goes away within a couple of weeks of surgery. But lymphedema, the swelling of the soft tissue of the arm, is not something that goes away. It is something that can be managed, but right now there is no cure for lymphedema. So again, when discussing the lymph node surgery, if a woman is having a sentinel lymph node procedure only, the risk of lymphedema is about 5 in 100. About 5% of women will develop lymphedema with sentinel lymph node biopsy. If a woman requires a complete axillary node dissection, that risk of lymphedema goes up to about 20 out of 100. So 20% of women may experience lymphedema. And again, this is the most significant complication associated with breast cancer surgery because it is something that is it's manageable, but it's not curable. So it becomes a long-term reality that the patient needs to manage. The other surgical risks, again, as we said, bleeding and infection, these are rare. They're short-term complications that can be managed and appropriately resolved.